I'm Maryann Oklesson, and I'm a new business developer, director of new business for a small publishing company. And the magazine is New York Family. It's a family-oriented magazine for wealthy families in New York. What to do with their children, where to send them to school, activities, things like that. Well, my problem was about 2.5 years ago, I developed sciatica in my right leg. And I'd never had this kind of sciatica. And I thought, oh my God, you know, and at first it would just come and go. I'd be walking along and then, ooh, something hurt. And, but then it would be all right. But after a while, and I thought, so stupidly, I thought, oh, it'll go away. Well, it didn't go away. It got worse and worse and worse. Finally, I had to use a cane just to walk. And I thought, you know, this is bad. and it hurt. Every step I took hurt. And I said, Dr. Varma, you know, please x-ray my hips. He said, well, what kind of pain? I said, oh, I have back, you know, I'm getting this sciatica. He said, well, that comes from your lower back. And I said, no, it can't be my back. I never have back problems. And he said, well, let's do an x-ray. Well, sure enough, I had 3 vertebrae out of alignment, like ping, pang, and pong. And I thought, oh my God, my back. I mean, what does that mean? And so I asked him, I said, well, you know, what's the solution? I said, you know, I'm having trouble walking. I have this terrible sciatica. And now everything I've heard about spinal fusions was not too positive. It was, oh, you're in a lot of pain. It's going to take forever to heal, you know, blah, blah, blah. And I've never even remotely had anything with my spine, anything wrong with the spine. You know, he was really great. He answered all my questions. He explained the minimal invasive technique, which he does a lot. And he's also a teaching doctor, I found. You know, he teaches other physicians how to do the minimally invasive. You know, he showed me, he, you know, described it, how long it would take to heal. So we scheduled the operation a month after I saw him, because I knew I couldn't wait. I mean, it was really bad. My walking, everything, it started, the sciatica affected everything. It affected my way of life. And I have a really active lifestyle. So we scheduled the operation for July 24th, 2018, and at Mount Sinai, and everything was just great. Obviously, I was overnight in bed, you know, overnight. And then I spent two nights at Mount Sinai. And, you know, you have the sciatica, of course, was gone. That disappeared immediately. And the only pain I had, of course, was from the surgery, you know, which is normal. But, you know, right away they get you up, and I walked around the hospital room, the floor, and, you know, and then recovery. And it took, I was back at work. Let me just say this. I was back at work after 3.5 weeks, not months, but weeks. Well, you know, in every way. I mean, I came in, I had a post-op checkup right away. Took the stitches out. You know, that went well. You know, it was a really good recovery. And I felt really confident with every visit, you know, that it was turning out right. And, you know, he would look at the x-ray and he'd explain, you know, now look at this and look at that. Well, there are a lot of back surgeons out there. But I would say Dr. Varma is, from my experience, is one of the most concerned, meticulous, dedicated back surgeons out there. You know, he really knows what he's doing, and he also teaches the method to other surgeons. And he understands the body and healing, and you know, it was a good experience, as good as experience that a 4-hour surgery could be.